very possible. Anyway, we'll go ahead and get started. My presentation is about 30 or 40 minutes long, and I'll try to go through it fairly fast. Just before I begin, you know that probably the most important thing to remember about, well, first of all, how many of you have heard of the Patient Protection and Affordable Care Act? Just raise your hand. Okay, very good. So usually I ask that in a group, and a few people will raise their hand. And then my second question, I say, how many of you have heard of Obamacare? And almost everyone raises their hand, right? Because that's pretty much what the media has tacked on to the law as the name of the law, and it's actually not. The name of the law is the Patient Protection and Affordable Care Act, and you can see that it's Public Law 111-148. It was actually passed into law on March 23rd of 2010. So what you may not have known is that the law has already been law for 3.5 years. And I know that seems a little odd because if you still turn on the TV, the news, you will find that there's still fighting and arguments going on over the Obamacare and whether or not it's legal or not legal or legal and what they're going to do with it and all the troubles with the website. But it's actually already been law for 3.5 years. And in fact, a lawsuit went to the Supreme Court over a year ago in June of 2012, and the Supreme Court ruled that the Affordable Care Act is constitutional. They did change a couple of provisions in it. The biggest provision was that the law made Medicaid expansion for all states mandatory, and the Supreme Court said you can't do that. You can't make states do Medicaid expansion. So they changed that to be optional. And so what that means is that a state can now choose whether or not they want to do Medicaid expansion. And a lot of states did do Medicaid expansion, probably about half the states, but the state of Oklahoma, if you've been keeping up with the politics of it at all, has chosen not to do Medicaid expansion. So when you think about the Affordable Care Act, I always think about a pie, and there's pieces in the pie. The act was designed so that the pie represented all of the U.S. citizens, and that every U.S. citizen would have access to some sort of health coverage. Okay, either Medicare, Medicaid, or private insurance. Well, now that we aren't doing Medicaid expansion in our state, there's going to be a piece of that pie that's missing. Right? So there's a whole number of individuals in Oklahoma that is still not going to have access to health coverage because we're not doing Medicaid expansion. I kind of get handsy here, so sorry about that. Yes, sir.
Quick question about Medicaid expansion. Does the government provide some funds for Medicaid expansion?
Yes, sir. Under the law, if a state does Medicaid expansion, they get reimbursed by the federal government 100% for a couple of years, and then it goes down to, I think, 90 or 85% after 3 years. So yes. So in effect, if a state doesn't do Medicaid expansion, they're losing that money into their state. Okay, so probably the most important thing to remember about the Affordable Care Act is that if you currently have some sort of coverage, Medicare, Medicaid, or private insurance, this act does not affect you, really. Okay, so that's probably the most important thing to remember about the Affordable Care Act. And then overall, the act contains some insurance reforms, and you've probably all heard about this. You know, it does away with lifetime limits. It does away with not being able to get coverage because of pre-existing conditions. There are some reforms for insurance that's contained in the Act. The other thing is that in Medicare Part D, do you all have anybody have Medicare Part D, which is your prescription coverage? Okay, so currently in Medicare Part D, you have what we call a donut hole. So after you get up to a certain amount, there's no coverage until you reach another amount, and then you have coverage again. Well, the Affordable Care Act closes that gap, so there's no longer a gap there. So that's a benefit for anyone that has Medicare Part D. The other thing the Act does is require a health insurance exchange. And states also had the option whether or not to create their own health insurance exchange, or if they didn't create their own, they would fall under the federal exchange. The state of Oklahoma chose not to create our own health insurance exchange, so we come under the federal health insurance exchange. And the last thing the Act did for Indian country is it reauthorized the Indian Health Care Improvement Act. The Indian Health Care Improvement Act was passed in 1975, and it is the authorizing legislation that allows tribes to operate their own health care system. Okay? Before, that was authorized for 10 years. The law was 10 years. And every 10 years, we'd have to go back to Congress and fight for a new authorization. Well, the Affordable Care Act made that law permanent, so now we don't have to go back and fight anymore. So that's a permanent part of the law. So that's something really good that the Affordable Care Act did for Indian country. It also has some strategies in it to reduce the uninsured. Some of those is that it provides premium assistance for individuals. So if you're under a certain percent of income, and we'll get into that more later, then there's some premium assistance that you can get to help pay your premium so it doesn't cost you as much. It also has some penalties in it. One of those is the individual mandate, which means that if you don't have some sort of coverage, Medicare, Medicaid, or private insurance, and you don't get on the exchange and get coverage, then you're assessed a tax penalty. Okay, so everybody's probably heard about that, the individual mandate that you're going to have a penalty if you don't have insurance. So you might ask, why is the Affordable Care Act important for Indian health care? Well, there's a couple of big reasons. Some I've already talked about. But one of those is from now on, there's a single enrollment form for Medicaid and insurance. Before, if you go to, probably most of you use the Bartlesville Clinic here in town, the Indian Clinic. So if you go there, they have someone that helps you apply for Medicaid or apply for Medicare or Part D or whatever. They had enrollment forms for each of those programs. Now there's going to be one single enrollment form. So that probably doesn't matter a lot to you, but it matters a lot to the healthcare people that are actually having to fill out all those long forms. And then the second thing it does is it provides a new revenue stream for tribes that provide healthcare. Because now more people are going to have coverage, and the tribes will be able to bill that insurance and be able to build you new facilities. And Mary just told me you all are getting a new facility here in Oshaleta, I think, which is, outside of Bartlesville. I'm not too awful familiar with this area, but I know a little bit about it. So that's probably how the Cherokee Nation is doing that, is through that third-party billing that they're able to bill your Medicare, Medicaid, and private insurance for. I would assume, I don't know that. But so, what is Health Insurance Marketplace? Well, basically, it's a web-based approach where individuals can get on and compare insurance plans and then pick the one that they want to enroll in. Okay? So, in the insurance exchange, there are classifications of plans. And I'm not going to go over this in depth, but you need to be familiar with the terms. And basically, there's a bronze, silver, gold, and platinum. And all that means is, have any of you had private insurance before you were on Medicare? So your private insurance, like it would pay, you might say the insurance will pay 80%, and you have to pay 20% in deductibles or office visits, those kinds of things. Well, under this, that's all that means. So a bronze plan is going to pay 60%, and then 40% is going to be paid by the individual in co-pays or deductibles, right? The silver plan is pay 70 and the individual's 30. Gold is 80 and 20, and platinum is 90 and 10. So that's all that means, really. So there are some special provisions and protections for American Indians, and that's what I'm really going to talk about today. And this is important for you all to know this stuff for your family members too, right? Because I'm sure you all have lots of family members that may be affected by this. So American Indians, Alaska Natives are exempt from the tax penalty, okay, for being uninsured if they meet the conditions of the definition of Indian under the Affordable Care Act, and I'm going to tell you what that is in a minute. Or they can get a hardship exemption, and I'm going to go into detail about these two exemptions. Because if you don't take anything else away from today, I want you to understand these exemptions so that you can tell your family members what they need to do. Because I hear people say all the time, American Indians are exempt from the tax penalty. We're not going to be penalized for not having health insurance. Well, that statement makes me really nervous because it's sort of true and it's sort of not true. You actually have to do something to be exempt. You're not just exempt because you're American Indian. You have to fill out a form. You have to apply. You have to get a number. So there are stuff that you have to do, and I want you to understand that and know what that is so you can pass that information on to your family and friends. Okay, American Indians, the second thing is that we're exempt from most cost sharing. And the cost sharing means your co-pays and deductibles. Now, if you currently go to the Indian clinic, you don't pay co-pays and deductibles anyway. But I'm sure some of you at some point have to go to a private physician, either a specialist or, you know, some physician that is not at the Indian clinic, and you might be subject to deductibles or co-pays. Well, under the Affordable Care Act, if you're enrolled in the exchange, then you would be exempt from that. And the third thing is that there is monthly enrollment period. So if you're on Medicare, you know that there's a annual enrollment period, right? Like from, I'm not sure what yours is, October 15th to December 7th or something. You can go in and change the plan you have or your prescription Part D plan. Well, in the Affordable Care Act, there's an open enrollment period. However, American Indians are not subject to that. So American Indians can enroll, drop a plan, or change plans any month throughout the year. So the open enrollment period does not apply to American Indians. So just a little bit about the cost sharing. There's two kinds of cost sharing. And again, when I say cost sharing, I mean co-pays and deductibles. Okay? There's two kinds. There's zero cost sharing and there's limited cost sharing. Okay, so if you're at 300% of federal poverty level and below, okay, so from 0 to 300% of federal poverty level, that's where your income falls, then you will never, and you're in the exchange, you will never have any cost sharing. You're exempt from it, no matter where you go for services. If you're above 300%, you have limited cost sharing, which means that either if you go to the clinic, the Indian clinic, of course you won't have, but if you go to an outside provider, if you have a referral, there won't be any cost sharing. And that doesn't have to be a referral for payment. It can just be a referral from your doctor. So it doesn't necessarily have to go through the contract health process. Everybody's familiar with contract health, right? Yeah? Yeah, okay. Thought so. So basically, just think about it. There's two categories. 300% and below a federal poverty level, there's no cost sharing, even if you have a referral or not. Above 300%, there's no cost sharing if you have a referral from your Indian clinic. Okay, subsidies to help you pay the premiums. American Indians have the same premiums as everyone else. So everyone's treated the same according to premiums. And the subsidies that you can get to help pay those premiums are based on your modified adjusted gross income. Okay, that's from your federal income tax return. Those, you actually get those through what they call advanced payment tax credits. So that means when you go to file your income tax, depending on where your gross income is, you apply for these advanced payment tax credits, and you get those up front, and that's the amount of money that the government's going to help pay your premiums in the insurance exchange. And that's done up front, like in January. And then in December, there'll be a reconciliation of that to make sure that your income stayed similar throughout the whole year. So it wouldn't affect you if your income doesn't change. And this is just a chart that shows what your federal poverty level is. And I talk about that a lot in my presentation, but to just kind of give you an idea. So for your zero cost sharing, I said under 300%. For a family of two, that's $46,530.
Is that in the paper?
Yes. It's slide number 14. So there, as always, there's barriers to enrollment in the exchanges, right? Some of those are just people are scared of insurance, right? Just don't know much about it, and you're just kind of scared about it. I mean, I am. I don't know much about insurance, and it just seems like I'm paying it all the time for something. My car, my house, my something all the time. But I really don't know much about it. I have little knowledge or experience with it. And so that's a barrier to enrolling in a health insurance plan. And then there's really no motivation for American Indians to enroll in the plan if you can get an exemption and not get a tax penalty, right? And you can still use the Indian claim. So there's really a lack of motivation there. So there are places that you can go to get assistance if your family members or if you don't have some sort of coverage and you want to look to see what you might qualify for. You can go to your Indian clinic down here in Bartlesville and talk to your patient benefits coordinator, and they should be able to help you sit down and compare the plans and tell you what your options are. So probably one of the biggest issues in the Affordable Care Act is that to be eligible for premium assistance to help pay your premiums, you have to file income tax because it's all done through the IRS. There are a lot of people, about 40 to 50% of the general population don't file income tax for various reasons. Either they don't make enough money to file income tax, or, I mean, there's just a whole host of reasons why people don't, that are legal reasons. But if you do not file income tax, you can still buy insurance on the exchange, but you will not be eligible for premium assistance. Okay, so that's probably the biggest thing to remember about the IRS. So this is just a chart that shows what annual premiums by income level with subsidies would be. So there's limits on what the insurance companies can charge you for premiums now. Okay, so if you're 138 to 150% of federal poverty level, the insurance company cannot charge you more than 2% of your income for premiums for your insurance. So there's caps on what the insurance companies can now charge for insurance premiums. Okay? And you can see that that actually comes out to be $345 a year for insurance. So that's pretty good for health insurance. That's about $25 a month. So if your income was in that category, if your income was $15,800 to $17,200, the most you could be charged would be $20-something a month for health insurance. So that's pretty good. So if you have family that don't have any insurance, you know, it'd be worth their time to go somewhere to the clinic and have them to look it up and help you look to see what they might qualify for, because they might be surprised. There's some people that qualify for health insurance at zero premium. I've seen some that has $2 a month premium. So there's different amounts depending on what your income is that you would qualify. So it may be worth checking that out to get some health insurance. So this is what I really wanted to focus on. So this is on the tax penalty. So remember, the health care law, the Affordable Care Act says, if you don't have some sort of coverage, either Medicare, Medicaid, or private health insurance, that you're going to be assessed a penalty. Okay? So you're going to get a penalty. Now there are exemptions that you can get from that penalty. And there's about 13 of them, but 2 of those are specifically for American Indians. Okay? So the first one is for the Affordable Care Act definition of American Indian. That definition is that you have to be a member of a federally recognized tribe. So if you meet that definition, you can apply for and get an exemption from the tax penalty. Now you probably may have some people in your family that are Indian, but they don't meet that definition. And there's lots of reasons why people don't meet that definition. Either they are still children and they haven't ever applied for their tribal membership card, or some tribes have blood quantums and you can't be a member if you're under a certain amount of quantum, but that doesn't mean you're not Indian, right? It just means you don't meet their blood quantum. So there are numerous reasons why some tribes have cut off their membership. So there's lots of reasons why you might have an Indian person that is not a member of a federally recognized tribe. Those people can apply for a hardship exemption if they use an Indian health facility. Okay? So if those people qualify and go to the Bartlesville Clinic here, the clinic can give you a letter saying that they're a user of that clinic and you can qualify for the exemption that way. So there's 2 different exemptions. One is for members of federally recognized tribe, and one is for Indian Health Service users. Okay? So there's the different ways to get those exemptions. If you're a member of a federally recognized tribe, you can apply through the marketplace, the exchange, and get your exemption. Or you can apply through the IRS when you file your taxes. So there's 2 ways you can file to get that exemption. If you don't meet that one and you're an Indian health user, the only way to get that extension is to apply through the exchange. Okay? So documentation. You're going to have to document and verify what you're saying. So is everybody in here a member of a federally recognized tribe? Do I have anybody that's not? Okay, so if you are a member of a federally recognized tribe, then you should have a membership card from that tribe, right? I have one, it's in my billfold. So I have a card. So you make a copy of that, you'll fill out the exemption application, you'll attach it to that. You can either mail it in or you can get online and upload it and send it online, okay? Now, you don't need to worry about this right now, but I'm telling you this because I don't want you 2 years down the road for the IRS to send you a bill for your tax penalty, because you're going to have to do something to be exempt. So when you mail it in, they'll say, Melissa Gower, yes, she sent in her tribal membership card, check, she's Indian, and they're going to send me a number, a certificate with a number on it. That number I'm going to put on my tax return at the end of the year, and that's how the IRS is going to know I'm Indian and not to give me a penalty. Otherwise, the IRS will not know that you're Indian, right? They don't know if you are or you aren't. So you're going to have to do something to show them that you are. So you can use a document issued by your tribe saying you're a member, or you can use a certificate of degree of Indian blood. And those are 2 separate cards, okay? So that's what you can use for that exemption. Yes, ma'am?
Is there a form we fill out, like my granddaughter or something that doesn't have insurance? Where do you get the forms to fill out?
Okay, that's a really good question. So the form is not out yet, okay? We've been working on it at a national level to try to make sure it's simple and easily accessible. And the government put it out for comment, and the national policy groups I work on, we've provided comments. And I am told by CMS or SOCIO, who's the government agency overseeing this, that the form should be online by the end of December or the 1st of January. But that's okay, because you just have to do it before the end of next year. Okay? Because once you do it and you get that exemption, it retros back to the January of that year. Okay? And if you get this exemption I'm telling you about, if you're a member of a tribe, it's forever. So you never have to do it again. So I would just say healthcare.gov, www.healthcare.gov is the website. You just check that probably the 1st of January, just check it, and on there it should say exemption application or something. If you'll just get that and print it off, you might bring copies down here and pass them out to people so they can fill them out and attach their documentation. Be sure when you attach documentation, you attach a copy. Don't send them originals. Just a copy, because they're going to verify it and then they're going to shred the document. So don't send them originals like you have to Social Security. Just send copies. Okay? Now, if you're not a member of a federally recognized tribe and you want to apply for the hardship exemption, then you have to meet the eligibility of being a user at an IHS facility, right? So that means your granddaughter that hasn't gotten her tribal membership card, but she goes to the Bartlesville Clinic. So that's the hardship exemption. And for that, you just have to have a letter from that facility saying that she's a patient there and is eligible for those services. Fill out that application, put that documentation, and mail it in. Okay? So I know this is really complicated, and I tried not to make it complicated, but there's lots and lots about the IRS and the gross income, and I don't even think you really even want to hear about all that, because it really doesn't affect you at all. But if you take nothing else away from talking today, I want to make sure you understand, just because you use the Indian clinic or you're an Indian, you're not exempt from the tax penalty. You actually have to apply. So how many knew that? Nobody knew that, right? Because people are going around the country saying, if you're Indian, you're exempt. Well, that's sort of true and sort of not true. Yes, sir.
Can you explain the deadline of being registered or enrolled or whatever by January 1st of 2014? Because you did mention you've got another year for some other kind of deadline.
Okay. So there's different deadlines. So if you want an exemption, let's talk about exemptions. So if you want an exemption from the tax penalty, so let's say you have no health insurance coverage, okay? Because most of you probably have health insurance coverage. I know a lot of you have Medicare, right? That's health insurance coverage. So you don't even have to get the exemption if you don't want to, because you have coverage, right? The penalty is for people that don't have any coverage. So if you have Medicare or Medicaid or private insurance from your employer, then it doesn't affect you. You don't really need to do it. Now, if you just want the exemption, you can get it. I have health insurance coverage, but I'm going to get the exemption because I want